Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in.
Hi, I am Sara Thorpe, your host for today's episode. Today we're talking about vaginal health, not just BV, but the full spectrum of vaginal conditions that affect women throughout their lives. These are symptoms that cause worry, confusion, embarrassment, and often silence. And despite how common they are, many women still walk into clinics where 50-year-old diagnostic tools are used to answer very modern questions. I'm honored to be joined by two wonderful, remarkable leaders who have spent their careers pushing the field forward. Dr. Sharon Hillier, Professor, Department of Obstetrics, Gynecology, and Reproductive Sciences, University of Pittsburgh, leading researcher in vaginal microbiology and women's infectious diseases, whose pioneering research has shaped our understanding of the vaginal microbiome, and Dr. Diane Kawa, Senior Director, Medical Science Liaisons, Cepheid, whose work at Cepheid focuses on bringing accurate, accessible diagnostics to women everywhere. Their leadership reflects a shared passion for elevating women's voices, challenging stigma, and ensuring that women receive the answers that they deserve. Welcome. Thanks for joining us.
Thank you.
It's great to be here.
So to ground our conversation today, I'd love to begin with your shared story. How did you first come to know one another, and what has sparked this long-standing collaboration between the two of you?
Yeah, well, I'll start. Thank you for that, Sarah. So I met Dr. Hillier many years ago, decades ago, when I attended a workshop at the CDC, and she gave a talk on the use of vaginal products to reduce the rates of acquisition of HIV in low and middle income countries. So I was really in awe of her talk, and I went up to her to introduce myself as a fledgling microbiologist back in the day and told her how inspired I was by her talk. And so that was a lasting impression for me from that beginning. And I'm just feel privileged to have had the opportunity to meet her again decades later.
And for me, it was so exciting when Diane called me about 10 years ago after that initial meeting at the CDC and told me that she was working in the area of vaginal diagnostics and wanted to know if there were opportunities for us to work together. So that first introduction 20 years ago led to a reintroduction 10 years ago and really has led us to a shared passion for improving health for women by giving better diagnostic accuracy for women who seek care with vaginal symptoms.
So how has your partnership, your relationship really challenged some of your assumptions, whether it's scientific, cultural, or personal in this space?
Yeah, for me, Sarah, it's really been a journey, and of growth, really. And my career has led me from being a bench microbiologist all the way to the front now, where I do external engagements and talk to KOLs and educate people. So I can tell you that my relationship with Sharon over the years has really empowered me to do more of that, speak boldly, and specifically address cultural biases or norms, especially in the field of vaginitis. So the way I have seen her, and her mission to really improve women's care, especially in this area, has really motivated me, and been like, a mentor, someone to emulate in terms of carrying the message forward. And cultural biases is an important aspect. And so understanding that piece of it, she's really helped me hone in a lot on that.
Yeah, from my side, and thanks, Diane, for your really kind words. From my side, I think one of the things I've taken away from our long collaboration is that it's possible to really move the needle by forming these private public partnerships. That is, researcher working in a university setting like me can partner with somebody working in industry to tackle real world problems. So it's really been a privilege to work with lots of people in industry over my career. But there's really very few where we've become friends. And Diane and I have had a real partnership and friendship, which has transcended our work together, but I think also strengthened our work together.
I'm hearing both of you talking about that power of relationship and really accelerating change, driving change to better deliver care for patients. So, how do you keep women's realities, not just the data, at the front and center of everything that you do in your work?
For me, it's really easy. I mean, I have an extended family of women, and I've been privileged to work in the sexual health space throughout for most of my career, and so it's easy to have those conversations with the women in your lives, and so just hearing from them their perspectives, I use that as a platform to really educate, so it keeps their concerns at the back of my head. When I think about designing a test, I was in assay development at one point in my career. And I'm doing this external engagements. It also keeps those concerns at the back of my mind in everything that I do.
For me, thanks, Diana. In my strange position at a university, it's an odd thing. I get emails from women all over asking me questions. And I'm not sure how I became the person you would call if you had a weird vagina question, but that's me. And but that's kept me really very focused on some of the questions that women have in their lives or questions they can't get answered. I've also had so many experiences of giving lectures to professional groups of women who then come up afterwards to ask a very specific question that relates to them. So, what I've learned is that whether you're talking to groups of people in a community or you're talking to people online or you're even at a professional conference, there's a lot of questions that women need to have answers for. And a lot of the answers that women find online are really not very good. They're there to essentially drive a point of view or to sell a product that somebody's selling online. So people need good answers. And so I always think in my research, um, I only do studies that I would recommend for my sister or my daughter. And I only try to publish work that would help the sisters and daughters in my life.
I really appreciate those perspectives and how you are thinking about those around you and the work that you're doing every day. But I want to pause on the reality that women are facing today because for many women, progress still hasn't reached the exam room yet. When women present with vaginal symptoms today, they're often evaluated with diagnostic approaches that haven't yet meaningfully evolved in decades. So, what are the consequences you are seeing and hearing when women receive the wrong diagnosis or, like you're talking about, they don't have a clear answer yet?
Yeah, so I think when we think about like how did we get here? How did we get to this place? About 50 years ago, 45 to 50 years ago, people put together physicians put together some ways of diagnosing vaginal infections that were simple and could be done at the bedside and could give better answers. Before that, if there weren't good diagnostic clues at all for what women had. And so there were all kinds of crazy belief systems. A lot of people don't know that, for example, Lysol, the, disinfectant was first sold as a vaginal douche product so that women could be fresh. And for their marriages, because their vaginal conditions and vaginal odor were so common. So, like, we are shocked when we hear that kind of thing. But honestly, we had these initial first tools that were really good. It was basically you take some vaginal fluid and you look under the microscope and you take some pH paper and you measure the vaginal pH and look to see if there's vaginal odor. And these are sort of the very super simple tools that have been used. They were great 50 years ago. They were great 40 years ago. The problem is we are still using those tools. And what we've learned is that those tools are not extremely sensitive or specific, meaning you can have a condition and it won't be detected. Like, for example, you can have yeast vaginitis, which can cause terrible itching, but we know that microscopy is maybe only 50% sensitive. And we know that if you have trichomoniasis, which is caused by Trichomonas vaginalis, a sexually transmitted infection, microscopy is only 50% sensitive. So those kinds of conditions, even if a physician does it as well as you can, is really not very good. Even at their best, we're never aren't as good as they need to be for women. So the problem is we have that, and then we have this other issue that people want an answer the same day. And most times you can get better answers, but it's required that you send samples off to a laboratory and wait. But when a woman walks in with an itchy vagina or a smelly vagina or a concern, she wants an answer that day. So that's been the push and pull on the spot diagnosis using not very good tools or good tools, but I can't get an answer today. And that's been the sort of push and pull of diagnosis.
So here's another, thing to consider, Sarah, because when women experience these symptoms that Sharon has so well articulated, first of all, there's a stigma associated with it, right? And they're ashamed of themselves. They think they're doing something wrong. They don't seek care, right? That's the big hurdle. And they try to self-medicate. I can't tell you how many women think that whatever symptoms they're having, it's a yeast infection. That's the most common thing people think about. And then they run off to CVS or Walgreens and get the over-the-counter medication, thinking that they could self-treat with the gels, right? Now, the problem with that is we know that there are three causes of vaginitis, right? And so when a woman decides to self-diagnose and self-treat because she's ashamed to take action, then she's like in 50% of the cases, she's doing the wrong thing. And don't forget that when they do that, they self-treat and they're treating for the wrong thing. They're increasing the likelihood of whatever is there, it's becoming worse, right? And so the symptoms persist, and then there are consequences for at least two of the causes of vaginitis. If it's left undiagnosed and untreated, it could have adverse outcomes. In pregnant women, you could have consequences to the baby, not to mention the untold suffering the woman has, the morbidity. They feel awful, the quality of life, because they're not getting the right diagnosis. That is an important piece, as much as Sharon has articulated the problems with when they eventually decide to go to their clinician, and it's like a hit or miss with some of the current traditional methods of diagnosing vaginitis. So it's a problem on both ends, I believe.
So let's dig into the stigma, the shame piece. That's a very complex issue, both on the patient side, right? Who is continuing to access those OTC options as well. So, why do vaginal conditions carry so much shame even today? And really, how is that appearing in the exam room?
Well, I do think that there's almost no greater stigma in American society than odor, right? Being smelly or having something that you're afraid it is smells unclean or it smells unhealthy. And so I think there's some mixture of the lack of the perception of lack of cleanliness. There's a perception that it might be dirty, that you maybe it's wrapped around sexual activity. And then there's all this other overarching concern that I think women have, that maybe it's something they did or they might have something they don't know about. Maybe it's a sexually transmitted infection. And so it all comes together to make women both really nervous about what's going on, but also not sure what to do. And it's a very hard thing to walk in and say, honestly, after I have sex, I just noticed such a terrible odor. And it's a very difficult thing to admit. that you have something that's so stigmatized and so utterly unacceptable in our society. But, it's not just in America. If you travel, and I've done a lot of work in Africa and with African women, you know, the, sometimes they call it dirt, or they call it a vaginal discharge, or it's always some kind of a derogatory term that basically means that it's unclean. And so there's this sense that women have that if something's wrong down there, that it could have to do with sex, it could have to be do with being unclean, but that it bothers people a lot.
So, how do we rewrite that script? How do we rewrite the diagnostic playbook to start elevating these conversations?
So Sharon, I'm smiling here, as Sarah asked that question because I believe that even though we are professionals and Sharon is a researcher and I'm working in industry, but I think there's an opportunity to change some of the perception, at a grassroots level. And so for me, I look for any opportunity in any social setting. Well, I don't go to a wedding and start talking about vaginitis, right? But, even in an intimate setting with family members, especially women, and I cite an example where I was visiting a relative and she asked me, "What do you do for a living?" And I said, "Well, we are making tests, new tests for vaginitis testing." And I started to talk a little bit about some of the symptoms. And she said, "Oh, it's happened to me." And then you go further to say, "Oh, it's so common. You're not the only one, that this is happening to." And she felt, I could see her a sigh of relief, and that is where it's like we're beginning to break down those, the stigma, the stigma associated with this. But also, when you share with them that it, you could get this condition for any reason, for a whole number of reasons. It's not something that you were doing in particular. So I think there's that educational component where we need to empower women to understand what this condition really is. And then also the people in their lives. I often laugh with Sharon that once I was taking an Uber from one conference, I think it was IDSOC, to the airport, and the driver made the mistake of asking me what I was in town for. And I saw this as an opportunity, to explain vaginitis. And I also the opportunity to address some cultural barriers because I knew that he was likely from a background where this could be taboo discussion. And so educating the women as well as the people, the men in their lives is, for me, is fundamental. And if I could do it even outside the workplace, that's a great start. We need to educate more women about what is going on in this particular area.
So, I've heard you emphasize that not only do we want answers, but we need accurate answers, right? So, let's talk about what's making that possible today and where diagnostics are starting to catch up finally to what patients actually need, and so that we can elevate these conversations in a meaningful way for patients.
So Sharon, and she mentioned, some of the barriers, to accurate testing, in the routine clinic, the women go in and out, that their symptoms still persist. For me, one of the biggest breakthroughs, Sarah, is the research that has been done to understand the complexity of the vaginal environment. Okay. These infections are very complex. Remember, in the vagina, you have good organisms there that are meant to protect, the vagina from a whole lot of things. And then you have the bad players who come in when an opportunity arises and then they cause these infections. So I think our understanding of the complexity of not only of this particular area, but also these infections was a breakthrough, right? And so with that research has really influenced, the advances in diagnosis for these conditions. And so there's so many tests, newer tests now on the market. And one that comes to mind is a molecular test, we call them nucleic acid amplification tests. But I think the name that will be familiar to a lot of women is PCR. Remember, we heard a lot about PCR during the COVID time that you needed a PCR to get on a plane to go to Hawaii. Well, that a PCR test is like a nucleic acid amplification test where you get a tiny amount of the infection or the things that cause the infection in the sample, and you multiply it so many times that you're now accurately able to identify it. For me, that was a big breakthrough. Two things: a better understanding of the complexity of these vaginal infections, but that enables us now to develop the tools that we can be able to identify the cause in women who are symptomatic. And I think finally, I mean, one of the the even even more remarkable advances is that we've moved. You know, you see the guidelines say do a lot of the traditional methods that Sharon was talking about, and they were a little hesitant to adopt these newer methodologies. But we're beginning to see a shift, and it's very encouraging. And now we're able to get some of these tests in the clinics. You know, like the organization that I work for, you know, at Cefi, to mention that we have one of such tests, you know, and we know that there are many molecular tests out there, but one of the ones that we think is really helpful is having the test in the clinic, you know, that could help clinicians address this issue when women go in with their complaints. So we've come a long way, in my opinion, and it's really refreshing to see. There's shared passion across the board for improved diagnosis, and there are other people who have that type of intention as well, and we're moving the field forward.
So I think, thanks Diane for talking about the new same day test. And I think that having these PCR tests available in an hour is really a game changer for women. Bottom line is what we've had to do in the past. If you wanted to order a test and get a really accurate answer, you had to send it out, and to out by out, I mean to a laboratory that's complicated, right? That's under that that's regulated, and it couldn't be done at the point of care. With the new kind of technology, you can get these PCR tests in an hour in the clinic, and the test can be run by, it's not quite as simple as just looking at a color change, but it's still pretty simple. And it can be done by staff, just medical assistants and so on, working in the clinic. So it's really moved space age technology, if you will, into the clinical setting. So, what I'm excited about now is that you can have, if a woman comes in and she has a set of symptoms, she can be tested and get an answer that day during that visit. Does take an hour, so it's not instantaneous, but that's, you get the answer that day, and that way you can get the right treatment for the thing that you have. And if you don't have an infection, about 40% of women who have vaginal symptoms actually don't have a diagnosable kind of vaginitis. It doesn't need antibiotics or antifungal medications. So it does two really good things. It prevents giving treatments and the expensive treatments for people who don't need them or won't benefit for them. But it also, for people who do have a diagnosed condition, ensures you get the right treatment. So in a study we did at my hospital, what we found is that when this test was available, the provision of appropriate treatment was just went way up when these kinds of tests were available. So that it means that actually, when the information's available, clinicians who are taking care of women will use that information and make a change in the way they're treating, and women have better outcomes. And I think that's actually a miracle.
Yeah, I have to say, congratulations to you and the community. I feel like that is a huge, to both of you, a huge progress for women, and having something that helps validate the patient's experience, their symptoms, can only continue to shape and improve gaps for women in general, because now they trust the healthcare system. They feel heard and validated. And I think this is highlighting how modern diagnostics can really help enhance and give women the answers that they're looking for. But these tools, as we're talking about, as you just highlighted, don't implement themselves, right? And for real change to happen, when someone is willing to question, should we push for something new in our practice? Should we change and rethink our current models of delivering care? So, what would you say to individuals who are listening in who might be, starting to rethink their approach in this space?
Yeah, well, I'll wear the hat, having been in an organization that has developed a test like that, right? So our purpose is to increase access to these tests, right? And it's important for women. You can hear about a better product, but it's a different thing if you don't have access to it or your clinician doesn't have access to it. So that's definitely one way we in industry can contribute by doing everything we can and working with whoever we need to work with, to say, here's a test, here's the performance of the test. And a study like the one that Sharon is talking about, which is probably one of the most rigorous types of studies where you randomize women, you say you get treated based on this, you get treated based on this. It's that kind of evidence that we, from the industry perspective, need to provide the people who can help make access and equity achievable for a lot of women. So that would be my perspective, from an industry lens of somebody, an organization that makes this type of test. And obviously, there's a personal aspect where I go on the campaign to educate people as well, So, yeah.
From my perspective, and I really appreciate the efforts within industry to increase access. One of the things that surprises me a little bit is that a lot of healthcare providers don't really understand we've made tremendous strides in diagnostics. A lot of people are worried about the cost, and these new tests do cost more than looking under a microscope. But there's lots of different kinds of costs, right? A woman who comes in for a visit, even if she has insurance, is probably making a copay of 25, 50, maybe $60. She had to pay to park. She had to take time off work to come for that visit. And then we also know that using medication has cost. So, I do think we need a comprehensive cost analysis about essentially, yeah, maybe a test costs more, but maybe you're going to save the patient money, parking and copays, and you're going to save money on drugs that really aren't the right thing. So I think as I think about how to get these products more implemented into women's care, there's a social justice issue that is, I believe women have the right to a good diagnosis and an appropriate treatment. And then there's the sort of business issue of, is it cost effective to do the right thing? And I think we're still building that story. But I think women should know that they have a right to ask for a right answer and not to accept necessarily a sort of I don't worry about this. This isn't going to kill you, which I've heard some physicians say, and sort of minimize or gaslight their concerns. Women deserve answers to their questions and they deserve accurate diagnosis and appropriate treatment. Full stop.
I think you've articulated a lot of powerful, really important points there. And this brings up a question I wished I had asked earlier, which is why have other areas of medicine advanced their diagnostics while vaginal health has remained stuck in this older paradigm? Is this a science problem? I think we've uncovered no, the science has advanced. Is it a prioritization problem? Or is it that issue of discomfort? And do we really need to focus on the advocacy here?
Well, I wish I knew the answer, Sarah, for why women's health, as you probably know, only accounts for what, 6% of all research funding. Generally speaking, women's health research is underfunded. And so it's, to my mind, emblematic of the larger issue of the underinvestment in women's health. Um, but I do think the, the it doesn't do a lot of good for us to worry about where we've been. What we need to think about is where we need to go. And there have been complaints in the past that there really weren't other good options. And now we have good options, and we have evidence showing that using those can actually improve healthcare and give a more likely to provide appropriate treatment. And so I think we have to speak loudly about the right women have to an appropriate diagnosis and good treatment for their issues. So, you know, I think as women, we make up half the population. We are mothers of the entire population. Most of us have sisters. All of us has mothers. Many of us have daughters. Some of us have nieces. But as a community of human beings, women's health should be prioritized, not because it leaves men out, but because it keeps all of the world healthy. And we need to, I think, be much more vigilant about demanding investment broadly in the area of women's health, not just reproductive health, but women's health. Because women are not just different men, they're different creatures. We have different needs, and our needs are real and should be respected and attended to. And so that's what I mean about social justice as a woman. I am a very feminist in my belief system that we have underserved women in so many ways by just saying, this isn't important or this is just a woman's problem. All women's issues, health issues should be addressed with dignity and respect.
Yeah, and Sarah, just to add, because this is so has been so front and center what Sharon just said, it that has been my own guiding principle as well. But one of the things you mentioned just now is about the patient advocacy piece, right? And a couple of years ago, a colleague and I went down to some women's, advocacy groups down in Washington, D.C. to just even talk. Again, it was exchange, bringing awareness. It was really about awareness, to the issues and specific opportunities, that women could pursue for better care. And but the two organizations that we had visited, we had an audience with, their eyes lit up, literally, about the conversation. We're bringing the conversation. And me, I believe that our organization, we're trying to do more of those, reach out, even if it's for educational purposes as well. That is what we also need to be doing. We can reach out to the clinicians, we can reach out to the laboratories, but we also need to reach out to the women who are affected by this. So thank you for bringing up patient advocacy as a good point. Yeah.
I mean, I want to thank you both for sharing and demonstrating your powerful voices in this space. And I'm curious though, what do you wish someone had told you early on in your career about how to find your voice, how to stand up and activate that voice, especially in a field like women's health that is often deprioritized?
I guess I would say don't be afraid to speak up when you hear stories in a room or dismissal of women's concerns. Speak up, use your voice. And, it doesn't, it actually is very empowering, actually, to say, you know what? That joke about women smelling like a fish counter isn't really funny because that means that women have bacterial vaginosis probably, and it's actually not a laughing matter. So, I've gotten to the point after many years, the people who work around me certainly know that none of those comments are gonna be left unchallenged. And I think as women, we need to stand up for ourselves and for each other and for you know, the needs that we have as human beings to receive the kind of respectful care we deserve.
Yeah, for me, it's been a journey, Sarah and Sharon. And Sharon, we've talked about this probably, and my growth. It's been a growth because decades ago, I considered myself much of an introvert, but Providence, I now have this external facing role. And I've grown, I've become more vocal, I'm bolder now, especially in something that I do believe in, and I communicate that to different audiences. So I think Sharon honed in, you need to be able to speak up. I feel like I found my voice, around issues that matter to me. And when I look back on my career, how did I get into sexually transmitted infections and the likes in the beginning? Well, it's decades old and it's all coming forth, and I'm bringing people along as well, to educate them and be bold, So I do really thank people like Sharon, just watching them and how they deal and navigate, in this space has also empowered me to navigate in that space. And also people who are working with me to help all of us navigate in that space. So personally, it's been a growth journey, and I couldn't have asked for a better disease state to work on, to be honest with you. So I'm grateful that I've also had the support to go out and find my voice.
Well, again, thank you both. I think this has been a very inspiring and powerful conversation. Hearing about your relationships, supporting, uplifting each other, all the way to how we can integrate our voices more powerfully in everything that we do. What stands out to me really from this conversation is the opportunity to continue to move women's health from the margins, especially in areas like vaginal health, into the mainstream, and to advocate for that change. So, thank you again for your time and all that you do to keep the field moving forward.
Thank you.
Thank you, Sarah. It's been a pleasure. Thank you.
To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.